Mr. Speaker, ladies and gentlemen, the fatal flaw of the previous speaker is that they assume people are rational. But we live in the real world wherein people, even if they're aware of certain things, make all sorts of biases and decisions that are bad, such as engaging in vices or not taking the preventive measures that they ought to do, even if they're accessible. The question I have is, when was the last time you really got a checkup, guys? In status quo, doctors and physicians recommend it at least annually, wherein within schools and corporations, we already have a prolific access to existing mechanisms that allow us to be able to understand what's going on with us. Things like subsidized annual and physical exams and checkups. But the reality of human cognition is that it's not always rational. Meaning, because of reasons like human psychology and tenets of human behavior, which are riddled with all sorts of heuristics and biases because of fear, because of emotion, because of anxiety, people on average probably only get a checkup when they feel something, even if these things can detect at best and even if these things are as accessible. This is especially true among the urban poor, ladies and gentlemen, of which is probably the primary stakeholder in this debate, given the nuances for publicly funded healthcare and not just private healthcare. Meaning, these urban poor, because of things of the birth lottery and outside their locus of control, continue to do things like eat processed and canned goods full of things which make them disproportionately susceptible to things like cognitive heart disease, and even do things to be able to cope with their circumstances like drinking, smoking, vaping, etc. These are the very people we have to cater to. What is the problem? The problem is that side government also assumes control, but it's merely a specter and illusion. Things like cognitive heart disease, cancer, stroke, etc. are the top killers in society, and even with the best ability to diagnose and prevent these things, because of what I mentioned in my pre-oration, serve as a barrier for people to be able to take these steps because it's scary and uncertain. What is the problem here? The problem is that, at best, when you diagnose it, it's at an inflection point wherein, you can somewhat fix it or not, I said by a chat, or at worst, it's already at a terminal stage because, bros, even if you can detect these things, even with the most advanced technology, it doesn't necessarily mean that it won't be at a particular terminal level because we're not gods who can change technology and change how anatomy works. The nature of certain diseases that I mentioned are, in fact, particularly dangerous. What are the features of our model we want to talk about? This is a value judgment debate wherein we want to be able to help the urban poor, those who use public healthcare like public clinics and national centers such as lung, heart, etc. The status quo concern is that even if you're able to perfectly diagnose it, the late stage treatment wherein it's at an inflection point at best or at worst terminal still sucks ass. Meaning, people still wait months and years on end to be able to be dialyzed. They wait months on end or even years to be able to get a transplant. And those things are going to take even longer at the point in which the consequence of priority kicks in and their side delays these things, making that at worst harmful to these particular individuals. Government rhetoric is oversimplistic and they talk about how prevention will always work. Even if these things can kick in, the latter part of the curve is where people die, ladies and gentlemen, just like in status quo, but even more. What motivates our side of the house? 3 key things. Number 1, the human biases of fear and anxiety that disproportionately make people, even if accessible, make poor decisions. Number 2, the disproportionate way this affects particularly poor people, meaning it's not like these people don't have the time to go, don't have the capacity to go, but these people, because of circumstance, have to work and they trade that off versus their health. And thirdly, the nature of these diseases, wherein even at best, the way in which they degenerate and affect the body particularly harm people. The comparative is very clear on our side. The comparative is that as opposed to opening government being outcome dependent on being able to detect it, even if it's perfect, that's where the latter stage kicks in, and only the people who are rich and privileged can go to a private healthcare center because they can afford 100,000 pesos or X million rupees to be able to have a night in the ICU, as opposed to the urban poor who get more wrecked. Before I proceed, POI, whoever raised it earlier, go for it.
Yes, POI.
Yeah.
There's literally community-based testing which incentivizes the community to be tested even if they're irrational or they're stupid at worst.
Yeah, so we find out that more people in the population have like HIV or have stage 1 cancer. And then what happens, right? At the point in which, because of the circumstance, they don't do anything because it's scary or they're worried or they're super fucking busy, that's the point in which all of the harms in the medium to long part of the curve literally kick in, wherein you trade off capacity to be able to treat these things, which already have a high degree of mortality. The mortality rate increases at the point in which it's on the middle to latter part, which can still happen at the point in which, because of human decisions and human capacities, continue to get worse. Your side is assuming that, we detect it, it won't get worse. But that's an outcome dependency, meaning the benefits on your side only unlock at the point in which you take that treatment, and if that treatment works, but on our side, we're able to hedge that risk in the worst case that people don't do anything because of the realities I told you, and even if they do something and bad things happen for things like comorbidities, genetics, and the disproportionate situation that they're in because they're the urban poor, being more exposed to smoke and preservatives and all bad things, are able to make it worse. Meaning, we question the lens of Gov upside, but we defend ourselves from the worst, wherein I don't know if they'll get treated, but I do know for sure that even if they do get treated, we're able to deal with the scarier, higher mortality part of the curve at the point in which we're able to lower mortality, give people more access to the things that they need, which continue to be expensive, and lastly are able to skew government resources to be able to deal with the part in which it's scary. In status quo, we have a triage in an emergency room, and that's exactly what motivates our side of the house to be able to deal with those who are more disadvantaged and those people who are more susceptible. We are very proud to stand on side opposition.